It's a nightmare situation that more Americans find themselves in than you'd think. That dreaded phone call after you've been told that you have an STD, and now you've got to tell your partner or even partners that they need to be screened in case they have it too. But if you're not quite up to doing it yourself, well, you're actually in luck, because health officials in the Northwest are offering a new anonymous service to patients who'd rather not come clean themselves, and instead they can opt for a health specialist to break the news for them. Well, joining us now by Google Hangout is Anna Halloran, a health program specialist for Spokane Regional Health District's STD prevention program. Anna, thank you so much for joining us.
You're welcome. Thanks for having me.
Well, thank you so much for, this is obviously quite a sensitive topic for many people. You are tasked with this tricky phone call, as we just said. So tell us, just what is it like to call people and tell them that they might have an STD?
Well, it's a really sensitive phone call, and it's an important one, and we're really happy that we're able to offer that service to people. It's a public health core function to prevent and stop the spread of infections, and that's really what we're trying to do.
And in terms of sort of how people seek you out, what are the methods that people can kind of, come and find you if they have just been told by their physician or health practitioner that they do have an STD?
Well, when somebody is diagnosed with an STD, their healthcare provider is actually required by law to report that to the health department. So what happens is when somebody tests positive, their healthcare provider lets us know, and we end up following up with the patient to make sure that they get treated appropriately, see if they need assistance with any further services, and then we talk about partners. And sometimes people have already notified partners themselves. And if they haven't, then we offer anonymous partner notification on their behalf.
And so can you just give us a little sense of how this phone call goes down? You pick up the phone, and what do you even say? Like, where do you begin? What do you say when you're on the telephone and you're telling somebody?
Well, it's a confidential phone call, and we have to abide by health privacy laws. So we ensure that we're talking to the right person when we get somebody on the phone. We verify that with their name and birthday, and then we make sure that somebody's in a private location where they can speak for a couple of minutes. And then we identify that we're calling from the health department and let them know that they may have been exposed to an infection. Sometimes people are already aware of this. They might have suspected something because they had symptoms, but oftentimes people are surprised, and emotions certainly vary. It's a really difficult phone call to get, but we let patients know that we're here to assist them in making sure that they get testing and treatment.
Yeah, and in terms of the responses, what do people do on the other end of the phone? Have you had people crying? Do people break down? Do people get sort of, verbally quite violent? What are the range of reactions? What are some of the ones that you remember?
It really varies, and certainly all of the above are reactions that I've experienced with people on the phone. Some people are really sad. Some people cry. Some people are really angry. People sometimes will demand, really want to know who it was that may have exposed them. I have to keep those identities completely confidential, but usually people are really kind and appreciate the information and appreciate knowing where to go in our help.
Yeah, and I have a comment here. In this sort of segment that's obviously provoking quite a few comments, but this is Rona Berry-Morian, who says, how do you convince people that you're sincere? I can only imagine that many would hang up or not respond to your inquiries.
That happens sometimes, and we try sometimes different contact methods. If I do get somebody on the phone and they don't believe that I'm calling from where I say I'm calling from, I'll give them the main line for the health department, and they can ask to be transferred to me, and usually that helps as well. My phone number does show up on their caller ID as being from the county, so sometimes that assists also. But I do have that happen occasionally where people don't believe that I'm calling from where I say I am, and we just try to work with them to help them believe that I am who I say I am.
Yeah, Anna, I want to get onto some of the stats very quickly in a moment before we have to go, but I just want to ask you, you seem very cool and very collected, but I can imagine that sort of taking this home with you is quite can be quite a burden sometimes. How do you deal with it when you get home at night and you've made these phone calls and you've potentially upset quite a few people?
It's certainly difficult work, and I really try hard not to take my work home with me. I have a really nice distraction. I have a 15-month-old daughter that I play with nonstop when I get home, and she helps me forget difficult things. But then I come back to work the next day and get going again. It's just a matter of not bringing your work home with you.
And you know, it's an amazing kind of so it's kind of amazing because I know lots of people have been commenting as well, and they're kind of taking slightly more tongue-in-cheek approach to this, and as if it's like an SNL skit, they think it is. You know, but this is a serious issue, isn't it? Let's just get a sense of how big a threat STDs are. Here is the latest data by the CDC, and that is that there are 20 million annual new infections. So, you know, just giving us a rough idea, what are the most prevalent STDs and how are they being spread at the moment? Do you have any sort of sense of that?
Yeah, so HPV is probably the most common sexually transmitted infection, followed by herpes, trichomoniasis. Chlamydia is the most common reported communicable infection. HPV and trich are not required to be reported in most states, so a lot of our numbers are estimates. People acquire sexually transmitted infections through sexual contact, unprotected sexual contact, and people can take various measures to help prevent infections, condom use, mutual monogamy. We advise people to get tested regularly because a lot of these infections don't have symptoms, so it's important to see a health provider regularly.
And, you know, one thing about sort of STDs, and, you know, this is sort of kind of an arcane idea, but 110 million total infections in the United States at the moment. You know, do these impact women and men equally? You know, what about LGBT and that community? Because I know that typically people were, you know, erroneously thought that you know, certain STDs were more rife within that community. But, you know, in your experience, who are being impacted by these STDs?
Both men and women. These infections, a lot of them, if left untreated, can be more dangerous for women, particularly for chlamydia and gonorrhea. We're finding that women will get diagnosed sometimes more often because they're going to the doctor more often, not because they're getting infections more often than men, we don't think. But both sexes are affected equally.
Well, Anna Halloran, thank you so much for joining us today and for breaking down what is a pretty tricky job, I have to say, just by hearing it from you. So thank you so much, for your work.
Thank you for having me.
And guys, you know the drill. Stick around because there is a lot more HuffPost Live coming up next.